Some of our private emergency care facilities around town are serving as actual hospitals during this COVID surge, taking those patients who need emergency care but can't get into a hospital because of a lack of bed space. Our Michael Gibson visited one of those facilities and has this report.
This appears to be an emergency room you'd see inside any hospital. But instead, this is Physicians Premier ER inside the old Whataburger corporate headquarters at Everhart and Staples.
The doctor here says that while this facility is a freestanding emergency room, it is acting as a hospital, and he believes it's doing its job.
This is Dr. Lonnie SCHWARTLIck. He's the chief medical officer for Physicians Premier. He says since the pandemic, his facility has been allowed to handle patients for as long as needed until a hospital bed can be found or surgery can be scheduled. Before COVID hit, they were only able to house patients for up to 23 hours.
A lot of these patients should be in the ICU, and we're basically functioning as a full ER like we normally do. But in addition to that, we're actually functioning as small hospitals, helping to augment our hospitals.
Dr. SCHWARTLIck showed us around the facility, and much of the equipment they have here is exactly the same as what you'd find in hospitals. He says the level of care they're providing to people is having a big impact on not only the patients here, but around the state who come to one of these ERs when they can't get into a hospital. The doctor told us how many of those patients they've treated this month and how many folks across the state have turned to a freestanding ER.
Physicians Premier has seen 131 of those admitted patients that have been in our facilities. So that averages about 30 per site. We have 5 sites here. So if you look at the 200 freestanding emergency rooms out in the state of Texas and figuring that 30 is the average that they've held, that's 6,000 patients for this month alone.
Dr. Mary Dale Peterson is the Executive Vice President and COO of Driscoll Children's Health System. She welcomes these freestanding ERs stepping in to help out hospitals.
Thank goodness they're able to do that, because that's saving people's lives. Even though it's not ideal care. It's not ideal care for patients to be boarded in an emergency department in a hallway, which is happening right now for 1, 2, 3 days.
Dr. SCHWARTLIck says his facility has treated people for as long as 10 days before they were finally able to be admitted to a hospital or to have their own surgery. He says the work they're doing here is making a real difference and helping to save lives during this continuing pandemic. Michael Gibson, 3 News.